Hi, good morning or good afternoon, depending on where you're tuning in from around the world. I'm really excited to be here with you today to talk really about conversation training in the healthcare industry and the implications for it. To quickly go over our agenda, we're going to be, I'll introduce a little bit about FIRST so you have some context of who I am and our company. Then CHRISTUS Health, we have Lisa here from CHRISTUS Health, and she'll tell you a little bit about her organization. Then we'll get into getting support, which is not only just about how do you get buy-in from leadership, but how do you decide what kind of conversation training to bring in and really quantify that decision so that you can get the buy-in you need from leadership. Then we'll talk about sort of strategy, how to roll out this training, what are some best practices, how do you drop it down into the culture of an organization so that you're not just dealing with another sort of flavor of the month. I'm sure we've all run into that. We'll talk about sustainability. So what's the long tail on this training? How can we, again, avoid that flavor of the month and get this really drop down into the DNA of an organization and its leadership? And then my personal favorite part, and probably Lisa's as well, is to get questions from you. You know, what pain points are you feeling? You know, what questions do you have? Are there any barriers that you're experiencing that perhaps Lisa or someone from our team can help you push through, so that if this is the sort of training you're wanting to bring in, you can do that. So before we dive in, I want to tell you that there's a chat. You should have a chat window. I'm hoping you have a chat window on your screen somewhere. At any time, if you have a question for anyone, go ahead and type that in there and hit enter, and our producer will be taking those notes and sort of squirreling them away for later in the broadcast. So as it comes up, feel free to type, because I know if I try to remember, I don't. So, okay, so who am I? I'm Halley. My name is Halley Bock. I'm the president and CEO here at FIRST Incorporated. We're based in Seattle, Washington, although we train around the globe. I would say that really our fundamental belief is that what gets talked about in an organization and how it gets talked about absolutely determines what is going to happen or what is not going to happen. And that while no single conversation is guaranteed to change the trajectory of a company, a career, a life, a relationship, any single conversation can. And so often I think we allow conversations to pass right by us, and it's this unbelievable resource we have available to us that's free of charge, and yet we aren't given the skill in how to use conversations so that they actually produce traction for us in all aspects of our life. That said, there are multiple sort of key conversations, I think, certainly for an organization to master, to become as efficient as possible, and to ensure that they're building strategy on reality, and to become a best place to work. Those places are typically more profitable at the end of the day. So you'll see on your screen there's a variety of specific conversation models that we train in. How do you take a team and take people from your company and all disparate parts of your organization and create an internal think tank? How do you delegate? How do you get out of doing maybe all the things you love to do, but developing your bench in a way that's really clear, and you're not just sort of throwing someone off into the deep end or micromanaging? How do you create a culture of deep-seated accountability where people are signing up to sort of show up and follow through without you having to chase them with a stick or dangle a carrot in front of them all the time? How do you coach? How do you, as a mentor, as a leader, how do you develop the decision-making on your bench and really get an insight into that decision-making and then improve upon that? And of course, how do you confront? How do you have that conversation? If all else fails, if you're in the ditch, how do you confront and resolve an issue while putting the relationship in better standing? And then we have other programs on negotiations, on generations, which I would say is really an exercise in diversity. And finally, we are taking a lot of our models, our philosophy of how to show up in the world, how to appreciate more than one point of view to kids, because those are our future leaders, so that we also have a field guide that we're now taking into a lot of high schools around the world with amazing results. So there you have it. That's me. And I want to introduce Lisa Reynolds, who's the other one on the video here, and Lisa's with CHRISTUS Health. She's the Systems Director in Organizational Effectiveness. Thank you, Lisa, for being here with us today. We really appreciate your time.
Oh, it's my honor to be here, Halley. Thank you.
Fantastic. So, Lisa, would you tell us a little bit about CHRISTUS Health? Maybe, you have a compelling mission and your values. Sort of where is CHRISTUS Health approaching healthcare? What point of view?
Sure, I'd be happy to. So at CHRISTUS Health, we are an international Catholic faith-based not-for-profit health system. We are in 6 states in the United States and actually 6 states in Mexico. We have 9 hospitals in Mexico, and in April we just partnered with 2 hospitals in Santiago, Chile. So we're really looking at Latin America. And so if you want to get an idea of the size of our organization, we have 350 services and facilities. We have more than 50 hospitals and long-term care centers. We also have 175 clinics and outpatient centers. And we're about $5 billion in assets. We have 30,000 associates, and our population of leaders, where our focus is in our team, is about 1,500 leaders. And since we are a Catholic health system, our mission is to extend the healing ministry of Jesus Christ. And because of that mission, we really embed our core values of dignity, integrity, compassion, excellence, and stewardship into everything we do, especially our talent management.
Fantastic. You got to walk the talk, and it's difficult the larger an organization gets to keep that glue together.
It is.
So let's speaking of keeping that glue together, and obviously at some point you recognize that there might be a need for training and conversations in CHRISTUS Health. Can you take us a little bit back to that journey of, was it an instrument that you used to measure the issue, or did you sense it, or tell us a little bit about that?
I would say there are probably 3 components, and the first is because we're a Catholic healthcare ministry, we really believe in the philosophy that everybody has potential within them and resources, and if we can equip them with the tools to achieve their full potential, we're really living the Catholic social teaching of our sponsoring congregations. So we're sponsored by the Sisters of Charity of Incarnate Word, and really the charisms of those sisters that founded CHRISTUS Health back in 1866 with 2 separate healthcare systems, and we came together as CHRISTUS in 1999. They're all about courage and trust and accountability and simplicity. So we were looking for a conversation training model that aligned with who we are, both as an organization and with a focus on relationships. Relationships are so important at CHRISTUS Health. And I just want to emphasize one of our core values, dignity. We define it as respect for the worth of every person, recognition and commitment to the value of diverse individuals and perspectives, with special concern for the poor and the underserved. And so the model that we chose, which is Spirit, is just so aligned with who we are. So that was probably the first thing. The second thing was intuitively, we knew we weren't very good at having conversations, but we needed more empirical support to get the buy-in.
Sure.
So about 1.5 years ago, what we did was an extensive talent management assessment on our top 200 executives. So there was 4 hours of online work and then a 2-hour in-person interview. And out of that, we came up with, what are we good at CHRISTUS and what do we need to get better at? And no surprise, it told us that we are not very good at giving feedback. We'll give it to everybody but the person that needs it. So
yeah, that seems to be a human issue. I think we're all sort of, we come out programmed that way. We want to avoid that discomfort.
Right. And the higher up you go in the organization, the less honest feedback you were getting, so it was creating all kinds of problems. And the other thing I would say is on our associate partnership survey, our top opportunities were managers coaching their teams, involving their team members in decision making, and treating people with dignity and respect.
Right. So you measured so the skill sets available, and you uncovered this need. What was your process then of taking it? Did you need to go up the chain to achieve buy-in? I know a lot of folks, that's sort of the place if you're going to get stopped. If you're dealing with a CFO who needs to okay a PO. I mean, how do you get that sign-off on training, which a lot of people can think of as a soft skill and not really contributing to the ROI of an organization?
Right. Well, what helped us was the results of this executive assessment and knowing it was impacting associate engagement and productivity and turnover. Mm-hmm. So I was able to influence my leader that this was a good solution for the concerns that we had. And what we did is propose it to the HR vice presidents out in our markets to get their buy-in first. That this is a solution we think can really help us move as an organization and better live out who we say we are. We got their excitement and buy-in for it. I had budgeted some dollars for this type of learning, so we already had it in the budget, which was fantastic. And because of
that is, and that sort of brings up a question. Did you fund the training out of one budget, or did you sort of require different departments to sort of come and buy it and treat it as a cost center?
I think the success with our being supportive, the conversation training was, we said we would fund it at the corporate level. The 200 executives in our system all sit on the corporate payroll anyway, even though they're out in the markets. But typically, when expenses get tight, education and training is the first thing to be cut. So if it was being funded at the corporate level, it took that excuse away.
Right. Well, we're sort of naturally moving on to the rollout. What was there a particular sort of cadence you hit, or a set of dominoes that you thoughtfully pushed over one at a time in order to start this training and get it out to everyone? Did you offer open enrollments? Was it intact teams that came together? How did you start, and now how are you feeding it out?
So the first thing we did was do a train the trainer in June of last year. So we brought in people from each of our different markets, and we funded that, so we had the internal resources to roll it out. And then, because I had a conversation with you, Halley, when I did train the trainer in Seattle last January, I had that relationship with you. And you came and spoke at our leadership retreat in August to do an introduction to our top executives so that they got the message first, and they got excited about the tools that could help them be better at conversations.
Right. How important do you think that executive sort of, kind of buy-in, them seeing the content and being part of that? How key do you think that is to a successful then rollout to the rest of the organization?
I think it's probably the #1 critical factor. If our managers and directors are getting it and the executives aren't, they say, well, why aren't they doing it? So to have them go through first the foundational material and get excited about it, it just helps us get the momentum and the buy-in from the rest of the leaders.
Right. So yeah, go ahead.
So after August then, the last quarter of 2013, we started implementing it in our regions. And probably many of you on the call do quarterly leadership development institutes. So some of the training in our markets are rolled out at a leadership development institute. In our other markets, they do smaller classroom training in between their leadership development institutes. So everybody's getting the training, but it's customized to what works best in the local market.
That's very smart. So what results are you seeing from bringing this work into CHRISTUS Health?
So we just finished a year-long Leadership and Ethics Academy, and they actually got the training first. And we had our final session in Santa Fe, New Mexico, Monday, Tuesday, and Wednesday. And I wanted to read, if it's all right, just a couple quotes from the leaders to say how the conversation training has impacted their life.
Absolutely. Of course I want to hear it. But, you know, I mean, I think the important thing here is especially for the audience, I want you to know that, yes, you know, I'm the CEO of Fierce, and CHRISTUS happened to choose Fierce Conversations. I was having a conversation with Lisa the other day saying, you know, no matter what training anyone takes in around conversations, around actually getting together and having those conversations that need to happen, that want to happen, it really doesn't matter to me what you choose at the end of the day, as long as an organization is really starting to see the value of this and that it's not a soft skill and it really is a strategy for how to get business done. So, yeah, I would love to hear some of the testimonials that people feel this kind of training and conversations is impacting them.
Sure. So one of the leaders, who is a nursing director in one of our larger markets, says, conversation training has better equipped me to love and enhance others and my relationships with them through the words and honesty. It has reminded me that the people and the relationships are more important than the problems, and if handled correctly, the people and the problems become better.
Oh, I love that.
And then the second one is the impact of the conversation training is the true and deep realization that any conversation you have can have a massive impact on someone or some relationship or your institution. Not every conversation will, but having the realization that each one could take you closer to where you want to be makes you much more intentional of how effective you are in any conversation. It so aligns with what you started with, Halley.
It does, and you know, yeah, you know, I think just to shine the light on this topic. I think we tend to look at big consultants or big, you know, process and more efficient ways of doing things, and we overlook sort of this obvious thing of, gee, how are we talking with one another, and are we really talking with one another, or are we fighting to be right? You know, there's a big difference between being a manager or a leader or an independent contributor that wants to get it right for the company versus that wants to be right. I think even just the way we show up into a conversation is more than half of it.
Right.
So go ahead.
I was just going to say, I had one of the leaders come up and hug me and say, this has impacted not only my professional life, but it has changed how I interact with my family too. And you know, we care for the whole person.
Yes, yes, because typically how we show up at work is how we show up at home. If you squeeze an orange at work, it's the same thing that comes out when you squeeze it, you know, when it's under stress at home. So, you know, dealing with the whole person, I think is essential, and it certainly fits into CHRISTUS, you know, your culture and your mindset of your folks. So you were telling me, and I haven't actually heard this story yet, so I'm on the edge of my seat, but you were mentioning that the training and conversations had an impact on the response time of call lights in the hospital. Is that right? And if it's right, can you share that story?
Sure. One of our again, a larger hospital, that the team conversation model, after the leader went through that training, she did a team conversation with her nursing unit because they had all these complaints about call lights not being answered timely, which I know probably many of you on the call can relate to. So after going through the conversation with the team and getting everybody's perspective, they were able to, actually they came up with their own, they came up with it on their own to do exactly what the manager thought would work, but when they came up with the idea, they bought into it, and they even told her, you need to hold us more accountable. You're not being tough enough on us. And so they started doing the hourly rounding again. It was a conversation about how do we hardwire hourly rounding. And because of that, they had significant decrease in the call lights that weren't being answered.
Mm-hmm. Well, I love that. I know it's when I speak to, you know, even my friends about our work with in healthcare and with hospitals and how excited I am that we're partnering more and more in this industry, that's typically something that comes up is, yeah, my dad was in ICU and got transferred and then no one would respond to his call light, and so that just really resonated with me, and I know it's going to resonate with your patients. Just feeling like, you know, you're seen and taken care of. So let's talk about sustainability. What have you done, and how much thought have you given to making sure that, okay, people go through the training. Now, how is this sustained? How are you really making sure it's part of the culture, part of the way of how CHRISTUS does business now?
Right. And as you said earlier, we don't want this to be a flavor of the month where we roll it out and then it goes away. So we've done a couple things. We have organizational effectiveness resources out in all of our regions who are just fantastic. So they help link the conversation model language to everything we do. For instance, the advisory board is a healthcare company that helps deliver training on other things as well. So in Louisiana, they just had an innovation presentation by the advisory board, and at the end of that, the HR VP and the OE manager, Beth, if you're out there, Wendy was telling me how you linked the 4 objectives of a fierce conversation to other material. So did we interrogate reality? Did we enrich the relationship and provoke learning and tackle tough challenges? So first, we're embedding the language in everything we do. Yeah. And then when we come back to LDIs from previous sessions, we talk about how people have used the tools to keep it alive. We do the email follow-up campaign to remind us of the point. And also here at corporate, we talked about doing a brown bag because we talked about what are some issues that everybody talks about except with the right people, and how can we solve them? And so we'll bring people together to talk about them over lunch.
Yeah, to chase out those conversations. And you're doing something specific with all of the facilitators, is that correct? Kind of creating a group of those that have been certified in, you know, well, in our particular training in FIERCE?
Yes, we have what we call the fabulous FIERCE facilitators. And originally we started meeting monthly. We meet virtually, and we've gone to quarterly, so we can share learning as we're rolling out the training and the sessions and what we're hearing, and also to share great stories like the call light story. And talk about sustainability and what can we do next to keep it alive. So it keeps us connected and sharing best practices.
Yeah, I think the reason I asked you to share that story is I think that's really, that's where the rubber hits the road. I mean, that's what everybody wants to hear, whether you're on, sort of my side of it. It's like, did it matter? Did it make any change for you? Because I'm not doing what I'm doing just to push training out. I mean, FIERCE wants to change the world one conversation at a time. We're not shy about what we want to do. And so it helps us, but then internally, I think when you gather those stories and you start sharing them, then people within your organization can think, oh, you know, maybe they never thought of applying it in that way, and can really start to get more and more use out of it. And then also, you know, whoever's writing the check or funding it is knowing that this is not, you know, this is going somewhere, this is doing something for the organization in a positive way, and we're not just checking the box of saying, yeah, okay, we've given people this skill.
Right. Yeah,
and
I'm sorry.
Go ahead.
I was just to say, with another team conversation, we were able to save $50,000 because of a dispute in a vendor contract, and we were able to resolve it with the vendor because of the team conversation and the solution that came out of that.
Okay, well that's great. I mean, that's, you know, that's what I think a lot of people are looking for, and we often don't get, is like, no, really, it actually saved us this X number of dollars. That's wonderful. And so how are you, I imagine, you know, after the training, you're doing the typical smile sheet of, you know, how did this impact you? Are you doing any sort of measurements beyond that, aside from gathering stories, which is more anecdotal? Is there any sort of survey or anything you're doing at a later date, or do you have plans to continue to measure the effectiveness, and how are you going to do that?
Right. We actually have a scorecard we're creating. It's still a work in progress. Right now we're tracking how many leaders have gone through, because we have a goal of getting at least 90% of our 1,400 leaders through, and I think we're pretty close that they've all been exposed to some aspect of it. But we also want to see our associate engagement scores go up, and we'll be doing that in the May-June timeframe. So we expect to see an increase from last year. We would also like to see patient safety improve because of conversations that people have instead of fearing them.
Yes.
Our integrity line calls, that's where if there's a compliance issue or they feel like they can't get an issue resolved, they call the integrity line. So calls about leaders we expect to decrease. We're still working on collecting all that data. We have just centralized HR across the system, so now we're able to pull some data better. So we don't have any hard numbers to share yet, and that's our intention, to measure those things.
Yeah, that's great. You are, you know, still sort of early in the process, or I'd say, you know, midway down the road. Just to know that you have an intention to measure this, I think is important. That your department is being strategic about this training. Well, let's open it up to Q&A. I feel selfish. I've been able to ask all my questions, and I want to open it up to anyone else out there who has a question. I also want to introduce on the line, although you won't see her, but I hear she's lurking out there, is Lisa Colvin, who's our Vice President of Client Solutions over here at Fierce. And the reason why she's on the call sort of in the background just in case is because she's really partnered with Lisa Reynolds, it's the two Lisas, to get the training going in CHRISTUS. So Lisa Colvin, if you're there, welcome.
Good morning and good afternoon to some of you. Happy to be here.
Fantastic. So I've got a question. Here we go. This is from Melanie Nichols, and she asks, if an organization has historically used Crucial Conversations, what recommendations do you have for selling the transition to Fierce? That's a good one. I don't know, Lisa Reynolds, did you start with Crucial, or was this your first foray into conversations training?
This was our first foray. We did look at Crucial. Just felt it was a better fit with CHRISTUS as a Catholic faith-based system to go with Fierce. So I'm not able to answer how you might transition, although, Lisa, you may have had some clients that did that.
That's
Absolutely.
true. Lisa Colvin.
I think it's a great question, and it actually comes up a lot. And because they're different programs in terms of how you approach conversations and even just what happens in the workshop, I always say that the two can actually be aligned. And, you know, in terms of transitioning, because we have the coaching model and delegation and the team model, they're actually different types of conversations. So it can complement Crucial, or it can actually work alongside. So I think what you're doing is you're making available different types of conversations to your leaders. And we say that if you're really having more coaching conversations and team and talking about development, hopefully that need to have a confrontation conversation will go down because you're doing all the other things to have the conversation and not putting it off.
That's right. That reminds me of a story one of our facilitators told about. His grandpa was a firefighter, and they'd focus so much on, how to put out a fire quickly, and finally someone started to turning their attention to fireproofing. How can we make sure things don't catch on fire in the first place? Like, and I think that's a lot of what our models do, is to hopefully keep the car out of the ditch, to sort of fireproof that environment so you can have those conversations safely where they don't escalate to that high heat, super high stakes conversations. Thank you, Lisa Colvin. You fielded that really well. Here's another one. Clayton Wilfer asked, this is for you, Lisa Reynolds. Was there resistance within the staff or leaders in rolling this out?
I would say there was minimal resistance because the leaders said, this is what we need help with. We need help coaching. We need help involving our team. And we really need help with how do we confront and do it with grace and dignity. So the resistors that did come to the training by the end of it, and I think those from CHRISTUS on the call would echo, they said this material is fabulous. It really gave me some insights, and they're so excited for the rest of the conversation models.
Right. Great. Thank you. I wanted to go back and ask, I'm not sure that we talked about the Leadership Academy, because I think that is such a sort of really great way that you're attacking, rolling the training out. Can you tell us a little bit about what that Leadership Academy is, who the audience is, and if there's any stories to share from that?
Sure. So the CHRISTUS Leadership and Ethics Academy, we do it every other year, and from the pool of 1,400 leaders we have across our system, CEOs and senior teams nominate who can high performer to participate. And so it's a year-and-a-half-long program. It starts with a 360 for the leaders that are selected, and they get an executive coach for the year that helps work through the 360 and any other challenges they have. We have 4 on-site 3-day learning sessions as part of that year-and-a-half experience. And then also they have to do a project back in their local market outside of their scope of responsibility, so they're learning something new. And at the end of that, they turn in a project paper. So it's almost like being in a master's program for a year. So they've just turned in their papers. They just had their last session, and they'll graduate in April. And we wanted them to be the champions of the fierce material, so they went through it before their peers back in their local market. And were able to model it and be champions. And I can speak for myself and for the whole Leadership and Ethics Academy. It just transforms your whole life. I feel like I have a more open heart. I'm more curious, and things don't have to be certain. And I can just be real and honest, and it really does enhance relationships. And that has been the feedback from every single participant in our academy.
That's great. It must feel nice. I know I get the pleasure of this, but to show up to work and know that you're impacting people's lives in a positive way, and that you don't need to be on the front line as a practitioner to do that, and to get that sort of almost immediate feedback of, wow, I may not be putting a Band-Aid on someone, but I'm really going in deep and dealing with that inner self, and the stories we tell each other about what can I say, what can I not, or can this person handle the truth. So that's awesome. And we just got a question in for Lisa Colvin, and I want to remind everyone to, again, type those questions in the chat box if you've got them, and Nada, our fearless producer, will roll them up for us. This is for the other Lisa, Lisa Colvin. What are some of the main differences between crucial conversations and fierce conversations?
Okay, thank you. Great question. Well, as I noted before, I think some of the differences are we have some different conversation models that we practice in the workshop, and all of the learning is experiential. So participants are having real conversations, some of them that they haven't had, that have been put off for a long time, that they know they need to have. They're practicing team conversations to address maybe a real pressing issue or a strategy that they've been trying to solve for quite a while that hasn't been able to be solved. So I think the experiential part is probably most impactful in terms of the differences. While they both focus on confrontation or crucial conversations, the way we approach it is a little bit different, and the goal is to always enrich the relationship. And I think there's probably just more, I think we focus also on the mindset of a leader, and then through the conversation models, work on developing the skill set to have those conversations as a leader. So I would say those are probably the biggest differences, and the most impactful that we hear. Also that it's just easy to apply. When people leave the workshop, they walk out saying, this is a model that's easy for me to go out and have these conversations now, with my team, even as an individual contributor. And I think that's, when you think about learning, that's the most important thing, that someone's going to take the learning and apply it, to their role and to their life.
Amen. And I would add, I think another nice thing about Fierce that we did very consciously is to make it very customizable, sort of user-friendly. Every model can sort of click together. You can train it, the team model, as a standalone, and just pull people offline for 2.5, 3 hours, or click a couple models together like confrontation and team and make a longer day, and sort of do it in the way that makes most sense. You either spend a full 2 days taking everybody through everything if you decide all the models are what you need, or take one model at a time and sort of drop them out so that you're kind of letting things sink in and revisit it before you then train another model. Here's a question. This is from Judith Russell. Have you utilized the conversations with your Mexico facilities as well? Is there some cross-conversations?
That's a great question. We actually had 2 leaders from Mexico come to train the trainers, so they learned in English, even though that's their second language. And the materials are all in Spanish. They have rolled it out to their HR leaders across Mexico. So a member of my team, Nydia, and I did the foundation material with their HR leaders in January. That was about 25 people, and they're getting ready to start it with all their leaders in Mexico. And hopefully we'll be able to do the same thing in Santiago, Chile.
Yeah, I want to go there. I was telling Lisa Reynolds, I think they need another Keynote. and I need a travel buddy in Lisa Reynolds. That's amazing. So, and then I wanted to ask, I mean, there's all this, call it noise, whether it's positive or negative. It's this noise about the Affordable Care Act. Has any of this training impacted your organization's adoption of the Affordable Care Act? Is there anything there?
Well, CHRISTUS, because of who we are, our position is that everybody needs health care insurance so they can get health care to have a flourishing life. So if we're effective at conversations, we can better talk with patients and families who have questions about the exchanges and let them know about their eligibility. So it helps get more people bought into getting health insurance because they need that to live a fulfilling life. So that's probably the biggest impact related to the Affordable Care Act.
Fantastic. I had to ask. Here's another question. How does Fierce translate cross-culturally? Cross-culturally. I'm wondering, I'm not sure how to read that cross-culturally. Lisa Reynolds, do you?
I'm not sure if I'm going to interpret it how the person asking the question is. I would say what we've heard when we actually presented in English and there was a translator. They resonated with all the foundational material. Having conversations and building relationships, it seems to be pretty fundamental no matter where you live. Nydia, I don't know if you're on the phone where you could type a response.
Right. So, yeah, I guess maybe there was a follow-up question to training in Mexico and thinking about going deeper down into Santiago, Chile, and the U.S., and if there's any sort of barrier there. Have you seen that yet?
Some of the words translate a little bit differently, so as long as we can convey the meaning and get the right word, it's been helpful.
Yeah.
And this is Lisa. I'll maybe take a different spin on the question in terms of, how does fierce resonate across cultures? And having experience in Hong Kong and China, and we have many international clients, I think what we hear time and time again is that leaders want to have conversations. Oftentimes they just don't know how to have them. Their conversation doesn't go well, or it's a missed conversation. And Fierce gives them the tools, the framework to have the conversation. And I think that's what we hear is this was an easy framework, so I can say what I need to say, and in any culture. So we are international, and I think that's it's been impactful across cultures.
Great, thank you. I think we covered that one from all sides. I've got another question here. It may be our last. We'll see. We might have time for one more. This is from Judith Russell. She asks, around Affordable Care Act, have you seen an impact on your, oh boy, here's an acronym, HCAHPS scores and or internal communications?
Right, our HCAHPS scores.
You can tell I'm not from the
all of the people in healthcare on the call know that.
They all know what it is, yeah.
Yes. Our intent is to measure that in the future as we get more into the conversation model. So since we're not very far down the road, we haven't measured that yet, and we do expect to have an impact on that since it does impact our revenue and reimbursement.
Fantastic. Well, I'm glad you knew what that meant because, boy, I was out of my zone on that one. Okay, last question. This is from Jesse Guzman, who asks, if you, Lisa Reynolds, could narrow down the most important tool from Fierce for CHRISTUS, what would it be? Do the leaders buy in?
That's difficult because I love them all. The most important.
If you had to choose one.
I would say, and believe it or not, it's learning about the conversation that we have with ourselves and how limiting our own internal dialogue with ourselves impacts everything. And that's what will impact the coaching tool, the confront tool, the team tool. So learning to be open to a different context.
Yeah, there's for folks that aren't familiar with Fierce, there's a sort of module that precedes sort of any model. Once you have it once, you're done. You don't have to swallow the pill again. But we call it our foundations, and it really is that mindset of why are conversations important? What are some of the themes of why they often go wrong? And like Lisa Reynolds said, a lot of it tends to be with the conversation that we have with ourselves, sort of our context. How do we see the world? What are our beliefs even about this person as we walk towards them to have a conversation can absolutely affect our results. I believe we as humans, children of Christ or whatever your belief is, we're incredibly powerful at manifesting what we believe. And if we have a belief in there about somebody or are expecting a bad result, my goodness, we so often we'll make sure that we're right about that belief and take ourselves down. Not necessarily consciously, but one conversation at a time, we end up in that negative space. So thank you, Lisa Reynolds. It's one of my favorite concepts of fierce, and I think one of the toughest one because it's not out loud. It's happening internally. So I want to thank everybody for coming today and participating with us, especially Lisa Reynolds. Thank you so much. You did such a great job representing CHRISTUS Health today.
Well, thank you so much.
You bet. And if there's any other questions that didn't get answered, I know Nada, if she's got them, she'll respond to them. And if you thought of something or just didn't want to ask it in this format, you can email us at info@fierceinc.com. You can check out our website at fierceinc.com. Gosh, there's my Twitter. I should go tweet something so it's not like 3 days old. But the @fierceinc Twitter account has a lot more going on, so definitely check that out. Thank you again for coming. We appreciate your time.